Well, good morning, everyone. Welcome to OSU Medicine 411, and we are so excited to offer this program to you all from all around Oklahoma, the United States, and the world. While we would have loved to have hosted you all in person this summer, we're grateful that we have the opportunity to provide the information to you all virtually. We couldn't have put this together without our sponsors, and here's a quick video to thank them. Today's session is going to be led by Dr. Kent Smith, a professor of anatomy. We also have a great video on our main page for OSU Medicine 411, where you can learn all about the campus and our culture. Be sure to check that out and fill out the worksheet that can be found there. While watching all of our videos, be sure to answer the questions, and if you answer all of them correctly, you'll receive an OSU Center for Health Sciences face mask. If you have any questions during the session, please chat me. As for now, here is Dr. Smith.
Good morning, everybody. How are you? I'm going to talk to you about gross anatomy at OSU Center for Health Sciences, a little bit about our cadaver program, and most importantly, see that you receive all the answers to correctly answer the questions that Ashley is going to project to you today. So I'm going to share my screen with you, and I have a few things that I want to share. Can everybody see the screen okay? Thumbs up. Everybody know how to use little icons down in the corner? Okay. Thank you. All right, great. So the first thing we're going to start off with is a poll question. And that poll question is, I'm curious why you're here today. Why did you sign up for today's session? Is it because you want to be a physician, wear a white coat? Most of you are interested in medicine. That's great. So I was going to see if you're interested in medicine, or are you just looking for something to do? Is the weather bad outside? You prefer to be inside? Are you interested in gross anatomy? I am. I'm a gross anatomist. I'm the director of the anatomy course here at OSU Center for Health Sciences. Or this could have been the other, mom and dad. So in any event, we're glad that you're here. I'm really pleased to see the poll results indicate that you're here because you're interested in medicine. So I hope that we answer some of your curiosities today. So gross anatomy. Traditionally has been taught using cadaveric specimens, that is human bodies, for dissection purposes to learn about the real system. There have been a lot of developments in the last couple of decades for virtual reality. Some of you may be gamers. You have a headset. You can put these headsets on and wander throughout a VR virtual world of reality and look at the human body out of curiosity, but also surgeons will use the VR systems to train their residents to provide information to their patients as to what the surgery is going to do for them or the outcomes, things like that. And so anatomy in the 21st century has a lot of different venues that we can use to train people into anatomy. So anatomy at OSU Center for Health Sciences is one of the first courses that the medical students embark on each fall. They'll start in August and will run through December. Has anyone ever thought, I wonder where they get those cadavers, where they get those human specimens for dissection? Okay. Well, in the old days, well before my time, they used to dig up bodies and get paid for those bodies so that surgeons traditionally would dissect and learn about the human body. Well, let's forward several hundred years, and now we have donor programs. So there are a lot of federal and state laws that guide our use of cadaveric specimens. I'm on the State Anatomical Board for Oklahoma, and we oversee the use of cadaveric specimens for teaching and research purposes. There are two donor programs in the state of Oklahoma, one at University of Oklahoma Health Sciences in Oklahoma City, and the second one is at Oklahoma State University Center for Health Sciences in Tulsa. We're very, very fortunate to have our own donor program. At times over the years, there may be a shortage of donors. And so some medical schools struggle to find bodies or are even able to have bodies because they do not have the facility to dice. There are some in the country that do not have cadavers. We're very lucky in that we have cadaveric specimens. However, you may be familiar with this thing called a pandemic that's going around, the COVID-19 virus, and it is changing the face of our teaching at OSU Center for Health Sciences as it is across the nation for all of my colleagues in medical schools. And so right now we're preparing to maybe do a hybrid or a blended course where we might be able to use some cadavers, but we're going to heavily rely on our virtual dissections, our 3D animation, and figures of bodies. So that's a little bit about gross anatomy at OSU, and we get our specimens from our own donor program. We provide donors for other programs as well. I want to start off with a case study, and this is what we do with our medical students. So some of you may have had anatomy, some of you maybe never had any anatomy, some of you may have had what we call comparative vertebrate anatomy, where you learn about other vertebrates, non-human, such as dogs, cats, lampreys, sharks, etc. But we're going to start off with this case study, one of the most dangerous sports, baseball. So this case study, I want you to watch the video, and I'm going to see if we can share that with you locally with Ashley. If it doesn't work, then I'll come back in. We're having a little trouble with audio earlier. But watch this baseball player. I won't reveal his name. Watch this baseball player and see if you can see what happens to him.
Cannot hold it. It's going to drop in for a base hit. And Kiermaier hurt himself. Kiermaier hurt himself diving for that one and is holding that left hand.
And coming right off the field too. That's the tell. He's not even waiting.
All the way through. It'll zoom up on
a diving effort by
happens.
Kiermaier, and he is injured. Paul Harker helping to walk him off the field. And boy, that is not good news.
Now a soft little fly to center. Let's see it. Oh, he landed right on top of that hand. Oh, man.
Okay, that's good, Ashley.
Up and back.
Okay, thank you. Okay, great. So everybody can see the PowerPoint. We're back on the PowerPoint. So everybody was able to see the baseball player, outfielder, running towards the ball to catch the ball. As he stretched out forward to try to capture the ball in his glove hung up on the artificial turf. And when it hung up, it's pulling his wrist backwards. So he's going to hyper flex that wrist and put it out of its normal position. So this is when the injury is going to occur. So what I want you to think about, what tissue is damaged? Are we looking at muscle tissue? Or are we looking at other soft tissues like connective tissues, ligaments, tendons? Are we looking at a bony injury? And today we're going to focus on the bones due to our brevity of this course. And we're going to look at the bones from the elbow to the end of your digit. So essentially your upper limb is made up of a humerus. The proximal most part of your upper limb is your arm proper, between the shoulder and the elbow. And then from the elbow to the wrist is your forearm. And then you have, in addition to your wrist, your hand. So we're going to focus from what we call the cubital fossa, or from your elbow on the anterior aspect towards the distal end of your upper limb, the digits. This is our area of focus today for our case study. So I told you there's a single bone in the arm proper between the shoulder and the elbow. Forearm, there are two bones. You have the ulna and the radius. Anatomy is very, very descriptive. Most of the tissues are described and named based on Latin and Greek. So they're based on maybe the action of a muscle or a bone, the shape, articulations where bones come together, things like that were used by early anatomists to name these different bones. So the ulna and the radius are your bones in the forearm. Notice there's an anterior view and posterior view. So I want you to pause now and stick one of your hands out in front of you. So look at your forearm, put your palm face up. So bend your wrist. You'll see some creases in your wrist, the skin creases. Those skin creases are landmarks for particular parts of bone. And then you can see your thumb. Is it pointing away from your body? Yes. So that lateral side, your little finger is going to be on the medial side. It's the one closest to your body. So the radius is on the thumb side. The ulna is on the little finger side, the pinky side. Guess what the name of the nerve and artery that run along the radius is called? Right. It's the radial artery and radial nerve. What about the ulna on the medial side? The ulnar artery and nerve. Very good. So do we notice anything in this illustration in relation between these little bitty bones right in here and your forearm bones, your ulna and your radius? Look at the radius. It articulates directly with the first row of carpals. So you have the first row of carpals, that's the proximal row, closest to the body, proximal row. There are 4 carpal bones in that row. Again, look at the radius. It has a direct articulation with those carpals. So we consider the radius an upward extension of the hand. So force through the digits, through the metacarpals, through the carpals is going to have a direct force upon your radius. Okay, what about the ulna side? The ulna, there's a gap between the ulna and the proximal medial carpals, the lunate and the triquetrum. See that gap? So we consider the ulna as a downward extension of the arm. Okay, so any energy transmitted from above through the arm, like the humerus, through the elbow to the ulna. Again, transmission of force through the digits, the carpals, is going to have usually an impact on that radius. So let's look at the first row, the proximal row of your carpal bones. So under the thumb, right here, we have the trapezium. It's trapezoid shape, so that's where it gets its name. The scaphoid. Where on earth did we come up with the name scaphoid? Well, if you're familiar with Greek, scapho means a boat, and oid is like. So it's boat-like. It's kind of like an old ship, and not modern day cruisers, but we're talking about boats several hundred years ago. So working from lateral to medial, the next bone, the third bone, is the lunate. It's kind of shaped like the moon, partial moon. And then the triquetrum. What the heck does that mean? Tri means 3 and pyramid. So it's a 3-sided pyramid shaped bone. So this is your 4 carpals in that proximal row. Then we come back to the base of the thumb, and we're going to look at the distal row of carpals, again from lateral to medial. So we have a trapezoid, so it's trapezoid shape, and then we have this big capituate carpal, and then we have a hamate. We have a hook of a hamate, which is part of the hamate bone, looks like a hook. And then we have the pisiform. It kind of is fish-looking, fish shape. So those are your distal carpals, those 4 carpals. If you're familiar with the term mnemonic, the medical students will learn mnemonics to help them learn these bones. So the proximal row, again, from lateral to medial, you might come up with the mnemonic. For scaphoid, you could use the term sum. For lunate, like. Triquetrum, to. Pisiform, play. So some like to play. And then you can do the same for the distal row, again, from lateral to medial. So trapezium, though, they for trapezoid, cannot for capitate, handle it for handmate. So some like to play, though they cannot handle it. And if you come up with your own mnemonic, and the crazier the better, whatever helps you learn those. And that's the G-rated mnemonic that I can share with you. There are others that, believe me, you would remember these bones. Okay, so see if you can figure out your own mnemonic. That's one way to learn these bones. And it's not just learning the bones for the exam tomorrow, but it's learning them for a career of medicine. You need to know these bones. Okay, so we're going to work distal. We've looked at the forearm bones, the carpals, and now we're going to look at the metacarpals. There are 5 metacarpals, starting with the thumb, the hallux. You have the first metacarpal, the second, third, fourth, and fifth. Those are the metacarpal bones. What would we call those bones in the foot? Metatarsals. Okay, so metatarsals are in the foot. Working in distally, we come to our finger bones, if you will. Note that the thumb has a proximal and distal. There are only 2 phalanges of the thumb. The other 4 digits have a proximal, a middle, and distal. Now, I'm not going to share with you all the muscles, ligaments, and tendons with you today because we just don't have time. But again, let's take a time out. Put your hand in front of you, the palm up again. Take any of the 4 digits, 2 through 5. So I'm eliminating the thumb. Let's take your ring finger if you want, and grab the very, very end of your finger with the nail bed, and then try to pull that part of the finger towards you. We call that flexing. You're flexing that distal end. Okay, so kind of put some resistance. And if you're wearing long sleeves like I am, kind of look at your distal end of your forearm just above your wrist, and you should see some tendons tightening. Okay. Okay, now go to the next digit. So we're looking right here. We're bending, we're flexing this joint. Okay, look at the PowerPoint. We're flexing this joint. Now we're going to flex this joint right here. Okay, so flexing that joint, do you see any tendons that you didn't see before? Okay, you might. So there are tendons coming from the forearm that stretch and attach to the distal end of that phalanx, and then one to that proximal end of that distal phalanx. And so they have different functions. Some are pulling this joint, some are pulling this joint. So this is a proximal interphalangeal joint. This is a distal interphalangeal joint. So anatomy, it's full of terminology. When you take anatomy, you're going to learn a lot of terms and a lot of Greek and Latin terms. Okay, so here are bony structures. Again, the ulna, the radius, the 8 carpals, the 4 in the proximal row, 4 in the distal row. You have your metacarpals, 5 of them, proximal and distal phalanges for the thumb, and 3 phalanges for all of the others. On a side note, one thing that's kind of cool about these phalanges, they look very much like that of a black bear. In fact, it's not uncommon when people find a finger bone of a black bear, they think they found a human bone. Well, that's a story for another time. We're focusing today on medicine. Okay, so here are the bones of the forearm, the wrist, and the hand. So let's look at an X-ray. The player that was injured certainly had a series of medical images. He may have had an MRI, he may have had a CT scan, but he certainly would have had a plain film X-ray because we want to look at the bones. Does anybody know what bone this is? Okay, is this the thumb? Yes, this is the thumb. So you should identify this as the most lateral bone, which is the radius. Here's the ulnar right here. What bone is this? It rests in the proximal row of carpals and it's just below the thumb. So on the lateral side, proximal row. If you said scaphoid, you're exactly right. The scaphoid is commonly broken. It's not the most commonly broken bone in the body, but it is commonly broken. And there's, remember the radial artery I told you about coming along on the radial side? It'll send arterial branches to that bone. And if those branches are disrupted, you can have necrosis or deadening, dying tissue associated with that bone. It can become very serious. Here's the hook. Can you see the little silhouette, the highlight right here? That's the hook of the hamate bone. And does anyone know what bone this is? Okay, if you said metacarpal, you're correct. And specifically, which metacarpal? So there's 1, 2, 3, 4, 5. Excellent. So there are your basic bones that you can see during or viewing by X-ray. What about this X-ray? Do you see anything different about this X-ray? Is this one that I showed first normal? Do you see any fractures? Do you see any pathology? Anything going on? Any arthritis? Anything like that? Okay. What about this one? Is there anything different about this image compared to this image? Let's look close. Okay, right here's the radius. Oh, this kind of looks jacked up. Oh, look at all the carpals. That looks odd. This person's really been in a bad accident or not. What's going on? Well, this person's normal. This person is a young individual. So during development of your bones, the fusion of the end of the bones, this is a growth plate, epiphyseal plate. This is where your bones grow. As you get older, they become totally fused. You can still see the line in this adult, but there's no space and it's very, very well fused. So this is a nice adult. This is a young individual, and you can actually determine the age looking at what bones are fused and which are not. This is a very young person because even the forearm bones are not fused. Many of the carpals are not fused. And then look at the digits. These are not fractures. These are epiphyseal plates. All of these are epiphyseal plates. This is a young person still growing. Okay. I just thought I'd share that with you. It's pretty interesting anatomically. So before we show you the poll, I want to go over a couple of things with you. So most of you are interested in medicine, and that's why you're here. That's awesome. Have you thought about what kind of doctor you want to be? Do you want to be an emergency room physician? You want to be a medical examiner? And I know some of these shows may be well before your time, but I couldn't find some modern ones. And then Grey's Anatomy. Do you want to be a hospitalist? Do you want to be a family doc? You want to be a surgeon? General surgeon or orthopedic or OBGYN, any number of specialties that would work in a hospital setting. Or today it's pretty popular to be an infectious disease physician, okay, like Dr. House. Or are you interested in sports medicine? So we'll take the poll right now, and then I'll share a little bit more with you about sports medicine. All right. So there's lots of specialties, so we could spend the rest of the day talking about that. Thank you, Ashley. So sports medicine A lot of people think that sports medicine are primarily orthopedic surgeons. Today's case study is a good example of why people might think that. But most sports medicine physicians, the primary sports medicine physician or doc for each of these professional, college, and high school teams generally is a well-trained family physician that has had additional training in sports medicine. I know you're scratching your head, you're about to turn off this video, but don't. Why on earth would a expensive team have a family doc, especially trained in sports med? Well, let's just say have a player that's got COVID-19 and you want to figure out what to do to follow protocols. Are we going to rely on an orthopedic surgeon for that? Well, they could provide advice, but your best bet would be working with someone who's trained in an array of diseases and disorders, such as your family physician. And then if the player needs additional help, like a disease specialist, then he will call it or she will call upon that specialist. So that's just kind of a fallacy that a lot of people have about sports med physicians. And how do I know this? Because I was involved in our sports med training for a number of years. We had the #1 sports med fellowship in the Big 12, and that's spectacular. So that's a little bit about disciplines, different types of physicians. And so our third poll question, and it's our case study. Have you thought about which bone or bones this player may have broken? Is it going to be the ulna, the radius, maybe one of the carpal bones? Is it going to be the metacarpals? How about the phalanges? Which bones do you think this player injured? Okay, so I'll let Ashley put the poll up for you and you can decide. All right, now Ashley, don't close the poll. I'm going to go to the next slide, and we're going to, if you don't mind, I'd like to relaunch this poll after my next slide. Is that okay? All right. So our next slide, here we have an image, an X-ray image. You guys look at this closely. I'm going to go over the bony anatomy real quick. So we have the radius, the ulna, the first row of carpals, second row of carpals, we have tarsals, we have phalanges. All right, now, are any of those elements, such as a phalange, that's a bone, any of those bony elements, are they showing an injury, such as a transverse fracture or a spiral fracture? Okay, so again, radius, ulna, carpals, metacarpals, phalanges. Okay. So let's bring that, relaunch that poll and see if people want to change their answers. All right, so you see the poll results. Awesome. Now, a few of you had the correct answer to begin with. Hopefully you're seeing this right here. This is your transverse fracture of the 5th metacarpal. In fact, the metacarpals are the most commonly fractured bone in the body. You don't have to play baseball to fracture it, okay? So great observation. Thank you all for noticing that. It's not unusual that you would select radius or ulnar, because I could have been Smith and just the fractures more proximal. I wouldn't do that. But it's not uncommon to fracture the radius and the ulna either when you fall with the stretched out hand, and you would end up with a silver fork deformity, or the reverse of that is Smith's deformity, not after me, unfortunately, but so that's not unusual. Carpals, again, the The scaphoid is the most commonly fractured of the carpals, but again, the metacarpals of the 206 plus bones they're the most commonly fractured. Awesome. So I'll let you share those or save those poll results for me, Ashley. All right, so there it is right there. Nice work, everyone. I appreciate that. And so does the ball player. This is him. He's all wrapped up and hasn't had surgery yet, but will go in soon. Why would the physician or why would the physicians have ordered a plain film X-ray over an MRI or CT scan? Well, probably is money. The MRIs and CT scans are extremely expensive. Plain film X-ray, there's a lot of inexpensive portable machines that you can have at these events to do quick X-ray of a patient and see what might be broken. If they hadn't seen anything fractured or broken, he's certainly in pain. They would have probably gone on and done a CT or MRI to see if soft tissue would have been damaged, such as ligaments, tendons, etc. So that is my show for today. A little case study on broken bones of the metacarpals, a little bit of the forearm, wrist, and hand. Again, just bony anatomy. I appreciate your attendance today and your interest in OSU medicine. Please feel free to reach out to me anytime, and I'll respond as I'm available. You all have a great day.
Well, thank you guys. We're so excited that you were a part of this first session for kicking off OSU Medicine 411. And thank you to Dr. Smith for providing that presentation. That was fantastic. And as always, if you guys have any questions, feel free to reach out to me. And we'll have a survey over this entire program at the end of the week. So keep an eye out for that on Thursday. But as always, we are here if you need anything. So have a great rest of your day.